Martyna, thank you for joining me today.
Thank you for inviting me.
Absolutely. Tell me a little bit about Dane.
Dane is a wonderful boy currently. He just turned 13. On the day I was traveling for the conference, that was the day of his birthday.
Wow.
And we did celebrate on the weekend before. It was amazing event. He loved it. So.
Yeah. And what is Dane's diagnosis?
Well, it's more complex. It first started as diagnosis of autism when he was 2 years old. We had a little bit of developmental delay. He was not meeting his milestone. And then after 12 months, there was more health issues that occurred. Some lethargy, some GI issues first. So that's what we end up in the hospital with. They did a bunch of metabolic testing and some other advanced testing. Nothing really fit their algorithm at that time. And when he turned 2, he started having seizures. So then whole exome sequencing showed the GABA A receptor variant. At that time, nobody really knew what to do with it. And with my mom intuition or whatever, God's grace at the time, I will just do the best as I can to preserve and help him develop and grow until we'll figure out what can be done for that particular issue. So the diagnosis was GABA A, seizures due GABA A receptor. The treatment that started, it's emotional to talk about it because the science was not so advanced then as it is now. And the medication that they used caused progression of his condition, which was not really recognized as side effects to the drugs because nobody really even know at that time that there are gain of function and loss of function. That was some around 2020, I think, more discovery. And yeah, he was served the medications that are rather contraindicated in that. So we did not even know that we are dealing with the side effects of medication. The thought was it's a natural progression of condition. Well, it was not. It was like a progression of condition on the steroids, right? Because he was given the medication that made the condition even worse. So
now with the involvement of CURE GABA A, how has that changed? The process of tracking the medications, tracking these potential side effects?
I think they do tremendous work collecting especially data from parents because that's how you learn through that natural history about those things. And researchers doing their job with lab work and figuring out why, for example, right, the medication worked the way it worked, that it had a long-term consequences or short-term consequences. We don't know that yet in our case. And just having the community that gets it, what's the reality is and how hard it is, and they push for solutions.
Yeah. Going back to that original autism diagnosis, you said it was at 6 months?
No, 2 years. 2 years.
Yeah. Okay. When did you first start to notice something was different about Dane?
Oh, when he started not developing speech, which should happen, after 6 months. And he was very, actually, quiet child. Everybody were commenting that he is so quiet and calm.
Yeah. And that was when you first started doing testing. What were the initial steps that you took to try and discover what was going on?
Our GP practitioner and then referred us to the specialist. They did run a few tests that did not find anything. I think Angelman syndrome was one of them. X syndrome was first that they were trying to overrule that it's not the issue. His EEG before 12 months was normal. normal for development and normal for his age. There was no issues. And the one that was done in the period when he started declining and he started sleeping a lot, and we end up in the hospital because he was almost not waking up, was showing predisposition to seizure. So that's changed within 8 months. The change happened, and there were some things that that happened at 12 months that could trigger something. And because he had gut issues, they gave him a laxative, very commonly used Miralax, PEG, and that probably messed up more with the gut-brain axis. So there should be really more cautious approach to that gut issue in children in the early development.
Yeah, and if someone else has just received a similar or the specific GABA A variant diagnosis, if there's a mother out there, what would you tell her about what's coming, what to do? What advice would you give?
That's a hard question. As much as it's important to find a medication that works, targeting the specific variant, and that's the goal, right? But it's taking time. It's making sure that holistically you do everything it's possible in the right ways, and that's taking care of gut, of microbiome, check metabolically if there is anything happening, because when things are not going the way it should, there are compensatory pathways that are being triggered, and our system is much more demanding not our system, the kids the patients who are affected, it's much more demanding metabolically. So we are very fortunate that we are able to find a doctor and practitioners who are supporting us in that aspect. And yeah.
You mentioned earlier the community that is CURE GABA A. How would you define the value of finding community and finding others that are going through the same thing you're going through?
That's not the first community that I did connected with. The first community was autism moms, and they are incredible. Not only moms, I should say dads too, right? It's just all the parents sharing their journey and what they learned and what worked for their kids. And I think that's the most important and valuable aspect, because you are entering this unknown. You don't know where to turn. And here is people who did the trailblazing before you, right?
Right. Yeah, absolutely. Is there anything else that you would want to share about Dane's story, about if somebody is diagnosed, the path ahead, anything at all?
Today I learned that whole genome sequencing is actually, it's not ethically appropriate for newborn screening. That's only diagnoses that have very known treatments can have a newborn screening. But if I would be a new parent, whole genome sequencing, or even a much more broader trio with parents to figure out if there is anything, any surprise, you don't want any surprises, would help you tremendously, right?
Yeah, absolutely. Well, thank you for your time today. I appreciate it very much.
Thank you.